Doctor, we love you. We love following your social media feed, and it's great to be in this beautiful practice.
Always great to have you.
No, you're a star. We love you. We really, really do. We want to talk about a normal or a healthy baby, and and it even feels strange calling our babies normal or healthy, but why are we so fearful of this notion of, am I going to have a healthy baby? Am I going to have a normal baby?
Right. I think more than anything, it's the fear of the unknown. For most moms, couples, they don't have the medical background of what could go right and what could go wrong. So it's the fear of the unknown. But also it may be because people have had experiences, whether their own experiences of difficult pregnancy, an abnormal baby in terms of either a birth defect or a chromosomal abnormality. But it could also be all the things that we read on Google, right? And I always say, please get credible information. Every time you want to read something and you're thinking about falling pregnant or already pregnant, get credible information. I always say there's Instagram on the one side, there is Google on the other end, but right in the middle is your doctor or your healthcare provider. Get the credible information so that you are less anxious.
So there are various tests that are done during your pregnancy in order to make sure and to confirm that your baby is healthy. What are those tests that are being done when we are carrying our little ones?
Right. So we look for everything. First thing is we want to know, are you healthy as a mom? Let's start there. And then the second part of it, these are all what we call prenatal testing. So the first one is we look for the health of the mom. So we look for infections, we look for your blood type, we look for any underlying conditions, diabetes, hypertension, all those things. But there also are prenatal testing that looks for chromosomal abnormalities. The important word to remember is it is screening. Screening means it is not for certain that your baby something is wrong. It's just a test we do to suss out what is the risk. It's either low, intermediate, or high risk. Anytime there is an intermediate or a high risk, that's a red flag for us to say you need further testing, not that something is wrong with your baby. Also, if there are other underlying high-risk issues, a previous, for example, preeclampsia or hypertensive disease in your pregnancy, a previous diabetes, a previous, again, abnormality in your previous pregnancy, or something in the family, we would then say it is probably a good idea for us to check and test. So these are not definitive. It's only the diagnostic test that specifically will say something is or is not for your baby.
Is there anything that one can do during your pregnancy to ensure that your baby can be healthy or healthier?
Right. I always advocate as a woman, just stay healthy before pregnancy even. Things like neural tube defects are highly affected if somebody has not taken folic acid, for example. So that's why we encourage women. In fact, even some of our contraceptive now, they've got folic acid added for that very reason. So be healthy before you give yourself a really great chance. Also, read. Things like our age does play a role. So above 35 years, we start increasing the risk of particularly abnormalities, chromosomal abnormalities, but also other underlying things as we've mentioned, diabetes, hypertension. So just read, ask for credible information, and stay healthy before the pregnancy. And as soon as you start, or as soon as you've missed your first period, please get to a gynae and ask questions. Get a gynae that's nice and that you can relate to, because that goes a long way. Then you ask all the questions you need to ask.
What is classified as a well baby?
Well, baby, I would probably say a healthy in every way in terms of all the organs are fine, functioning properly. I think sometimes what is a bit of a misnomer is saying that, for example, a child with a Down syndrome is abnormal. No, I don't think that's abnormal. That is just a chromosomal defect, perhaps. That means the child may have some challenges. But I think we need to shy away from this idea that a normal or perfect baby is one that has absolutely... one of my sisters was born with an extra digit on both sides. That was normal for her, right? And there was absolutely nothing wrong with the rest of her. So it's important as well, the languaging that we use. You want to know from your doctor, your pediatrician, what are the challenges the child might have, because you do get things like, for example, it's not compatible with life. So when the defects are not compatible with life, that can be quite difficult. You need a lot of counseling, because then you may have an option whether you want to continue with the pregnancy or would like to terminate. But that happens at a much later stage, and you would have had to have extensive testing with the fetal medicine specialist.
What would the symptoms be of a baby that's not healthy? So how would you know that you're carrying a baby that is not healthy during pregnancy?
Symptoms. So maybe the best way to put it is, for example, how would we check for babies? So we would look for through an ultrasound, and there are different areas we would look for. We would look at how the organs are functioning, and if there's any suspicion or red flag, we send the person through to the fetal medicine specialist. They do further diagnostic tests, which will then confirm for us or not. Sometimes if it's something that is not in the chromosome, so it's not genetic, it's in the structures. Sometimes you find a baby that's got a stomach that's not closed. We can pick that up on ultrasound, for example, but then have a plan at delivery with the pediatric surgeon, with the pediatric doctors, and make sure that baby is basically the care is maximized at the time of delivery. I mean, even something like a baby that's born before 38, 37 weeks, that is not normal, so to speak, in the sense that that's a preterm baby, that's a premature baby. But it doesn't mean something is wrong with the child. It just means we need to put extra measures to make sure that we support the baby so that they do well, regardless of the fact that they're born before the time.
Now, I know you're not a pediatrician. In fact, the peds office is right across the hallway where we take our little ones. But there is that, a baby is born and now we have them, and you are concerned that there might be something wrong. And, often we blame ourselves, and you think it's something that you did during the pregnancy.
Absolutely. All the testings that we do, except for the invasive, the diagnostic ones, are not 100%. So if something was not picked up, and the nice thing is at delivery, particularly if something we are a bit concerned about something at delivery, a pediatrician is always available to be there and make sure. In fact, even when we think everything has gone perfectly well, a pediatrician will be there. They will assess the baby and make sure that baby is doing all the things that babies are supposed to do at that age. And if there is anything, they will take the time to explain, and also then say, what are the solutions? What is the next step? But I think there's something about a mother's love or a dad's love for their child, regardless of the differences. And I think we need to support parents. We need to encourage and reassure them about the fact that you have the team that will help you do what needs to be done and what is best for your baby.
Or for more podcasts and even videos on Dr. Mpume Zenda, you're welcome to follow us at Baby Brunch SA or go to our website for support. It's babybrunch.co.za.